Nursing Burnout by Heather Marshall, English 3010, Research and Writing. Nursing burnout causes us to lose great nurses. So what should we know about nursing burnout? We need to know how to avoid burnout, what causes nursing burnout, what effect this has on the nursing profession and our patients, and better ways to cope with stress. Nurses are generally overworked, underpaid, and all around stressed out. So retaining nurses is a problem. Does this have to do with burnout? First, we should define what nursing burnout is. Cortez and Daughtry define burnout as a unique type of stress syndrome characterized by emotional exhaustion, depersonalization, and diminished personal accomplishment. Burnout has been known to lead to increased absence from work, high turnover rates, and poor job performance. I think if burnout were better understood, maybe it could be better avoided. Is nursing burnout a myth? Absolutely not. A lot of people think that they'll go into nursing because they're going to make a ton of money, and they're usually disappointed. Most nurses don't think that they're paid enough for the amount of work that they do. Most nurses report some amount of stress at every point in their career. You have long work hours, usually 12-hour shifts, with minimal breaks, which leads to burnout. And hospitals are, for the most part, a fast-paced environment. Exhausted, discouraged, saddened, powerless, and frightened. These are the emotions experienced by nurses on a daily basis. Erickson, Grove, 2007. Nursing is such a stressful job, and the biggest pressure is emotional stress. Nurses are constantly surrounded by sick or dying patients that they have to take care of. This takes an emotional toll. The young nurses seem to burn out faster. It seems that maturity plays a role here. The older, more seasoned nurses need to mentor these younger nurses to prevent burnout. Overscheduling, poor support from colleagues, and patient-to-nurse ratio being underpaid and underappreciated will all lead to nursing burnout. In short, the nurses are working too many hours, not receiving the correct support at work, taking care of too many patients, and are not being appropriately compensated for the work they do, which this all leads to disheartened nurses. What effect does nursing burnout have? Most people would say that patients don't get the care they need and deserve. Aiken et al., 2002, says that nurses nationwide consistently report that hospital nurse staffing levels are inadequate to provide safe and effective care. Most of the time, this leads to medication errors. That could be giving the wrong medication, giving it to the wrong patient, or giving the wrong dosage. This can lead to the death of a patient. Nurses have to stay focused every minute of every day. They might forget to wash their hands, which could lead to an infection, or they might forget to document appropriately. Now we need to discuss coping strategies. Stacy Mitchell, 2008, on her blog, says that if you find yourself on the path of burnout, stop immediately. Try to take some time off, gather your thoughts, and talk to someone. Make positive changes in your life and try to be patient. Do something fun. When you find yourself in a stressful situation, make the focus positive and try to be at peace with yourself. Effective coping strategies will help the nurse to avoid burnout. Try to talk to a friend or a supervisor about your feeling. Find a hobby that relaxes you and stick with it. Remember why you decided to pursue a career in nursing. This usually helps. Learn a new skill related to nursing. It may renew your faith in your profession. Most everybody knows or should know that nursing is one of the most stressful jobs. And unlike some jobs, there's never a slow period. You don't get a summer break, you don't get paid holidays off, and you work most weekends. All of this, plus patient workload, lead to burnout. Nurses need to realize that by taking care of themselves, they'll be able to give their patients a caring and attentive nurse who is healthy and happy. Nurses, by default, don't lead a balanced life. They are overworked, overstressed, don't get adequate sleep or nutritional diet for the most part. By gaining balance in your life and career, you will inevitably avoid burnout. I am a first-year nursing student, and I can say I've definitely learned what stress is. I am very passionate about the nursing career, but I also want to avoid burnout and stress as much as possible. This topic definitely hit home because of the discussion of stress and the coping strategies, which I think any nursing student could benefit from. I know how hard I study, and I don't want it to all be thrown away because I get stressed out at work. The research here has helped me to learn that burnout does exist and how to avoid it. Thank you very much. Please see the references for any questions.